Good morning, everybody. Welcome to our Memorial Health Fund Information Session webinar. I'm so glad you could join us today. I'm Lisa Levin, Vice President of the Community Investment Team here at YCCF. Thank you so much for joining us and for the amazing work you do to improve the lives of the people you serve. And thank you for giving us the chance to partner with you in your work. Our goal today is for you to leave this webinar with a good understanding of our application process and to be confident in your ability to apply to us for funding. I encourage you to stay till the end so I can answer any questions you may have. A bit of housekeeping. If you're having a hard time hearing this, you want to use the audio settings tab to adjust the volume. Please remember to mute your computer. As you listen in. When you join today's webinar, you have the option to connect by phone or by computer. If you're still not able to hear us, you may want to phone in instead of using the audio on your computer. Go back to the calendar invite we'd sent you for this webinar to find the number to call in by phone. We'd like to hold questions till the end, when you can type in your questions to us here. And remember, you do have the option to submit your question anonymously. So here is our conversation for today. We're going to talk quite a bit about the fund itself. We're actually going to step through the application. Then we're going to talk about how to apply online and resources we have available, some quick tips, and then what happens after you apply and get funded. So let's talk about the Memorial Health Fund. It was created with the proceeds from the sale of Memorial Hospital to Community Health Systems in 2012. Through its grant-making program, Memorial Health Fund is continuing its legacy of care for York by improving the complete physical, mental, and social well-being of the residents of York, PA, now and forever. It has its own board, and I staff the fund. As you can see, the focus areas for health grants are pretty broad. Memorial is especially interested in grants that demonstrate impact and collaboration, particularly when organizations working on similar programs are able to do the hard work of aligning their programs to amplify the impact on the community being served. And in fact, sometimes we are requested grant funds for just that purpose, and they are often funded. Memorial is also looking for programs that can be sustained once the award period is over. So let's talk about the timeline. Please be aware that the larger the grant requested, the bigger impact it must be capable of achieving. These are grants up to $50,000, and we would like to see a lot of impact for a grant of that size. After you submit your application on August 7th, staff will read it and respond to you with any questions or clarifications that we think will help grant readers better understand your program. You'll have until September 18th to respond, when your application will move on to our grant readers. Our webinar today is about the competitive grant cycle, with a total of $300,000 available to grant this year. Memorial also is working with a health consultancy firm to develop a large partnership grant to systemically address isolation and depression in older adults. Grantee eligibility is limited mostly to 501c3s that provide services directly within York County. Now we're going to talk about the application itself. This is the first screen with the title and brief description setting the stage for the application. These two fields will be pulled for all reporting that talks about our grant slate. So this is the time to start looking at how all of your fields align as you explain your program. You want to be sure everything ties together, from your program title to your attachments at the end of the application. At the same time, you want to be sure to focus on the specific information requested in each field so you don't repeat the same information in multiple fields. Remember, we're looking for character counts and not word counts, so we're looking to make sure that you're pretty rigorous in what you say and how you say it. The program type is whether this is a new program or whether you're expanding an existing program, or whether this is an early stage grant for planning or other purposes. Pay attention to details. Be sure your program start date isn't before funding decisions will be announced in November. The amount requested is what you're requesting from the Memorial Health Fund, not the entire program cost. The date requested is when you anticipate you'll actually need the funding. Remember, grant funds won't be available till late November and can't be used for program purchases you've already made prior to that date. You may have a standard mission that you use, and that's fine. What we're looking for more specifically here is how your mission relates to this grant. So if that's not immediately apparent, this is your chance to make that connection for us. You can upload an existing document here with your board of directors if you already have one. Just be sure it helps us understand who your directors are by including their affiliations. The question about who is leading this program is your chance to tell us the great qualifications of the people you have running your program, what their experience is that relates to this work, how long they've been doing it, and other details that help us understand why this person can help the program succeed. Telling us about your program and the statement of need are the largest fields of any of those on the application. Take advantage of this opportunity. Only talk about the program in the first field, not why it's needed, and only talk in general terms about what it will achieve. This gives you plenty of space for detail so people who don't know your program can really understand it. How many days a week will it meet? For how long it lasts? What are the different program parts? You may want to say it helps something, get people exercising, changes eating habits, but you don't need to explain here how much change program participants will experience. You'll have a chance to talk about this later. Each section of the application is a unique opportunity to build your explanation of why your program should be funded. In the statement of need, you should be specific about linking the need to your program design. Use data where you have it. How few people exercise or have good eating habits. You have a lot of characters to work with here. Use the space to help us understand the critical importance of new or expanded programs like yours to address this need. The outcome is where you'll tell us the change this program will make. People will improve their health, for example, or lower their disease risk. After that, you'll tell us how you'll know the outcome is being achieved. Everyone who applies will need to select at least one indicator, method of measurement, and degree of change when applying for funding. These terms are defined right on the application, and you want to pay close attention to what they say. An indicator is the observable, measurable change your program will make. So, for example, people in the program will lower their cholesterol level. The method of measurement is how this change will be measured, the tools you're going to use to measure it. How will you know that your program is making a difference? We know that you know that it is, or you wouldn't be running it. But you need to document for us the change your program is making. Try to stay away from pre- and post-testing or self-reporting, especially if you're requesting a large amount of money, and especially if you use that to measure multiple indicators. The degree of change, we suggest you be realistic here. It can be a percentage, it can be a number. Don't overpromise how many people you believe will be served by your program or how many people will have their lives changed. Realistic expectations of numbers served and degree of change demonstrate that you have a true understanding of the challenges and opportunities faced by your program. Do be aware, however, that grant readers will look for how much money you're requesting and how many people you will be impacting, and expect there to be a relationship between those two. Together with the next fields, number served and how you arrived at this number, all of this will be put into your post-grant report, and you'll have an opportunity to explain what you actually achieved compared with what the program design anticipated. This helps us and you learn together about what worked well and less well and why. Telling us why this program should be funded is another opportunity to talk about how great your program is. What's powerful here is if you don't repeat something you've already said, but rather dig deep and tell us the unique reason why this program is so important. Remember, many grant readers may not know your program or how it's different from others with which they may already be familiar. This is your chance to position how this program is different from what already exists. Now the budget. The total program budget is the complete cost of the program for which you're applying for funding. It's not your organization's total budget or only what you're requesting from us. Instead, it's the full budget of the program you've been describing. If you have committed already from other places, we ask that you also show it here. If you have an existing budget for this program, you can simply upload it, or you can use the template we provide. Be sure to show what in this budget you are requesting from the Memorial Health Fund, and make sure this matches what you filled in when you first started this application. Sometimes applications get passed into different departments within an organization, and we find sometimes those numbers don't match in the end. Also, show what may already have been committed from other sources, or you have requested, or you intend to request. And if there's revenue, be sure to show that as well. And of course, include all of the expenses that will be incurred by the program. A couple of quick additional fields are after that: the main program area your organization is engaged in, and the grant program area. There are drop-down menus for these. While we would like you to be thoughtful in what you select, these fields are mostly for our own year-end reporting. This is the last narrative part of the application. You may or may not expect to expand this program, and this is your chance to explain this. Maybe it's a pilot to prove a proof of concept. Maybe it's something that could be eligible for public funding once you can demonstrate your capacity to run it and make change. Or maybe you don't plan on growing it. This is your chance to explain your intentions here. The next question is critical, and one you really should consider before you begin writing this grant. How will it be sustained after the grant ends? No funder wants to grant to a program that will only last as long as the grant award period. Sometimes people say here that they'll fundraise more for it in the future, or that they'll budget for it in the future. Grant readers may wonder why you don't just do those things now. So this is your chance to explain that to us. There are support documents that are required for your grant to be considered for funding. And please contact me if you have any questions about these. These final fields allow you to beef up grant readers' understanding of who you are and the commitment of any partners with whom you may be working. Letters of support are from organizations or people who are willing to speak to their support of the program. They may not be working with you on it, or they may not be in a position to vouch for the program itself, but they can vouch for the idea, or for you, or for the quality of the work you've done. It's not necessary for you to have letters of support. For federal grants, letters of support may be required, but they may be allowed to be cut and paste with exactly the same content on different letterheads. We'd ask that you think twice before submitting these to us. Our grant readers actually look and read the letters, and it may undermine the sincerity of what your letter writers are saying. We do strongly recommend that you include letters of collaboration from partners with whom you're working on the project. If your program is going to be conducted in a nearby school, for example, you should definitely have a letter of support from the school saying that it's partnering with you on the program and what their specific commitment is. Are they just allowing you space? Are they promoting the program? Are they signing up program applicants? Their letter should make that clear. Additional file uploads are your chance to include anything else you think is crucial for people to see. Drawings of your new activity room, a logic model for your program, an executive summary of research on which your program is based, or anything else that you think helps your case for support. And that's it for the application itself. All grant applications must be filled out online using our grant system, Foundant, and we have resources also online to help you with this. Here's a couple of them here. Remember, if you've never applied to us before, you'll want to watch the tutorial video from the beginning to the end. These and additional resources are available on our website. Click on Grant Seekers and then Applicant Resources to find all kinds of materials to help you with the process. Here's just a few. You're also welcome to call me with any questions you may have. This webinar and the accompanying slide deck will also be posted on this link shortly. Here's some tips about applying. Since almost all communication about your grant will go out through Foundant, be sure when applying online to test the email system. All emails get pushed out through Foundant, and we've had applicants who skipped the test and then didn't understand why they weren't hearing from us because all of our communications went to their spam folder. This list of documents is one that we know from experience sometimes takes longer to gather, so we suggest you start pulling these together as soon as you can so that you don't miss the grant deadline. Finally, we recommend having someone who does not know your program read it. Their feedback could help you strengthen your application before you submit it. Remember, it's possible that our grant readers will not be familiar with your organization or with your program, so the only thing they'll know is what you have in your narrative. And if they're aware of other programs with similar missions, they may think that this work is already going on. Once your application is submitted for the last time, September 8th, we begin a vetting process looking at your financials and other inclusions in your application to ensure that your organization is eligible before an application is read or scored. Here's the rubric that's used to score your application, and this is also available online. You can use this as a self-evaluation process and to be certain your narrative is as effective as possible at meeting and making your case for support. The Grants Committee reads and discusses all grants that were submitted. So, congratulations. Let's say that you're funded. Now the work begins. We know that changes will happen, that what you submitted months before was a design. Remember, though, that you do need to contact us about any changes to your budget, your timeline, your staffing, the scope of the program. We would rather hear from you than read about changes on Facebook or hear about them third hand. We know that changes are common, and we're perfectly happy and willing to work with you to see how you can use the grant funds that were awarded as meaningfully as possible for the program as it develops. We want to learn together with you so we can become better partners with our grant applicants. Any reports will be pushed out through our online system. We may request an interim grant report so we can learn about how the grant is progressing. We will definitely request a post-grant report. Both reports include a single reflection field. Staff may request to meet after your post-grant report is submitted so we can talk in more detail about your experience with the program. We encourage you to talk with us before your grant is submitted to us. We have slots we're holding for this purpose on May 30th and June 3rd. We'll ask that you fill out a very brief letter of interest before these meetings so we can make the most of our time together. If these times don't work for you, remember you can contact us at any time to talk about your grant idea or to schedule a meeting to discuss it. And that's it for today's program. If you have any questions at this time about anything that you heard today about the grant cycle for the Memorial Health Fund, I'm happy to take questions now. So if you think of questions later today or later this week or anytime through this process, you all know how to reach me. I'd be really happy to hear from you and talk with you about your program idea. Thanks for participating today. Bye-bye.